I just want to give a couple statistics first. People may, feel like sleep is just their issue and they may not know that many people struggle with it. So if you're looking at some of the CDC, I mean, they're saying 50 million plus people have some sort of issue with sleep. 50 million people in the US alone. So that is huge. And then, of course, they've got this whole list of health conditions that are tied into sleep issues. So it could be things like stroke, cancer, arthritis, depression, diabetes. We know that if you're not sleeping well, your blood sugar is messed up from not sleeping well, and blood sugar can mess up sleep. So it's like this big connected spider web. That's a lot of people, 50 million people struggling with sleep.
Yeah, definitely a lot. New study that just came out over the weekend, actually. And the study looked at what's the optimal amount of sleep for cardiovascular health. They found 6 to 8 hours was the optimal dosage for sleep. Too high actually had an increased risk factor, and then too low also had an increased risk factor. So 6 to 8 was the sweet spot. Vitamin C is a really good adrenal support because a lot of adrenal stress creates oxidation. Obviously, your adrenals use vitamin C as a kind of a cofactor for adrenal support to make some of the adrenal hormones from a nutritional perspective, kind of like the thyroid uses selenium, so to speak. The adrenals like vitamin C. And then oxidation, we can have oxidation stress just from emotional stress. We can have it from poor sleep. We can have it from nutrient deficiencies. We can have it from pesticides in the environment. Of course, smoking is one of the most notorious ones, right? Smoking creates oxidation. The oxidation decreases vitamin C stores. Lack of vitamin C is going to be inability to make and to create your own collagen matrix in your body. So then you start to have these weakened nets underneath your skin, which then allow certain parts to sag, and just wrinkles and just that accelerated aging look starts to occur. So of course, we want to, number one, decrease the oxidative stressors that are affecting our skin: pesticides, smoking, excess of sun, sleep, nutritional issues. We want to supplement the good nutrition on the vitamin C side, and then also the building blocks, because the more stressed we are, the more we're going to break down amino acids. So get the really good extra collagen amino acids. And this is more important, especially if you're not eating the skin on the animals that you're eating and you're not making soups or doing broth. And it's even more important because you're just not getting exposed to those amino acids.
Yep, well said. So there's the answer. If you've been wondering all these years why when you look at a smoker, their skin looks so terrible and they look 20 years older than everybody around them who's not smoking.
I love collagen because it provides the mechanism for skin, the cosmetic aesthetic aspect. It also provides support on the gut aspect, and then it also provides support on the detox aspect. So many sides of it. Think of collagen as the scaffolding and all of the various osteoblasts and fibroblasts that are growing around it. That's the scaffolding that keeps it in place, right? Just like you need scaffolding around a building so the builders can maneuver their way up the building to put all of the rods and steel and glass and cement in place. Think of the collagen as that scaffolding that provides that strong foundation for your other building block cells to do what they need to do.